Blood flow problems, such as numbness, cold hands and feet, or tingling sensations, are often viewed as a minor inconvenience of aging, but they are actually a signal from your body that the circulatory system, the intricate network responsible for delivering oxygen and nutrients to every cell, is starting to slow down or become less efficient. This gradual decline doesn't just affect your limbs, it can influence energy levels, cognitive function, and overall vitality. The good news is that this process is not irreversible. With the right approach, you can nourish and strengthen your circulation system from the inside out, supporting both comfort and long-term health. Seniors can benefit immensely from focusing on foundational science-backed strategies that address the root causes of circulation challenges rather than simply managing symptoms. What causes circulation problems? The root cause of many circulation challenges in older adults is something called endothelial dysfunction. Think of your blood vessels as the plumbing system in a house. In youth, your arteries and veins are flexible, smooth, and resilient, allowing blood to flow freely. As we age, years of inflammation, environmental exposure, and dietary choices can gradually stiffen and damage the inner lining of these vessels, called the endothelium. This isn't necessarily a full blockage yet, but it reduces the ability of vessels to dilate and constrict as needed. As a result, even tiny capillaries that reach your fingertips, toes, and brain may not receive enough oxygen and nutrients, which can manifest as coldness, tingling, or mild numbness. The encouraging part is that endothelial damage is reversible with targeted nutritional support and lifestyle adjustments, meaning your circulation can improve and your body can regain its efficiency. The role of vitamin K2 in circulation. The first key nutrient for supporting circulation is vitamin K2, specifically in the MK7 form. Many people associate vitamin K with blood clotting, but K2 plays a distinct role in maintaining cardiovascular and bone health. Imagine K2 as a traffic controller for calcium in your body. While calcium is vital for strong bones, if your arteries are stiff or damaged, calcium can accumulate in the walls of blood vessels, a process called arterial calcification. This buildup makes arteries less flexible, reducing the ability of blood to reach distant areas efficiently. Vitamin K2 activates proteins that redirect calcium from your arteries to your bones and teeth, helping restore vessel flexibility and promoting smoother blood flow. For most seniors aiming to improve circulation, a daily dosage of 180 to 360 micrograms of MK7 is recommended, ideally taken consistently to maintain optimal benefit. The role of vitamin D3 in circulation. Vitamin D3 works in perfect synergy with K2, complementing its calcium-regulating effects by supporting vascular relaxation and anti-inflammatory processes. While commonly recognized for its role in bone health, D3 is a hormone precursor that interacts with receptors throughout the body, including the endothelium lining your blood vessels. One of its key functions is to stimulate the production of nitric oxide, a molecule that signals arteries to relax and widen, improving blood flow and reducing vascular resistance. When vitamin D3 levels are insufficient, nitric oxide production decreases and blood vessels may remain constricted. Additionally, vitamin D3 helps reduce chronic inflammation, a major contributor to endothelial damage. For many seniors, a daily dosage between 2,000 and 5,000 international units can support circulation, but it is always wise to confirm individual needs through a blood test with a healthcare provider. How K2 and D3 work together. Vitamin K2 and D3 form a dynamic duo for vascular health. K2 clears calcium from arteries, restoring elasticity, while D3 promotes nitric oxide production, relaxing the vessels and enhancing blood flow. Together, they address both the structural and functional aspects of circulation, ensuring that blood reaches all areas efficiently, including the extremities and the brain. By combining these vitamins, seniors support the health of their arteries in a natural, physiologic way, rather than relying solely on symptomatic treatments. This combination provides a foundational approach to improving circulation that can benefit energy levels, comfort, and overall wellness. Dietary sources of K2 and D3, including foods rich in vitamin K2 and D3 alongside supplementation, can significantly support overall vascular and bone health while enhancing nutrient absorption. Vitamin K2, especially in the MK7 form, is naturally abundant in fermented foods, with natto, a traditional Japanese fermented soybean dish, offering the highest concentration. While natto may be an acquired taste for some, hard cheeses, such as Gouda and Swiss, as well as grass-fed butter, also provide moderate amounts of K2. Vitamin K2 plays a key role in directing calcium to bones and teeth, while helping keep arteries flexible, supporting efficient blood flow. Vitamin D3, often called the sunshine vitamin, can be synthesized through regular sun exposure, but for many seniors, particularly during winter, or for those who spend limited time outdoors, dietary sources become essential. Fatty fish like salmon, mackerel, and sardines are excellent sources, as are fortified dairy products, which help maintain adequate D3 levels for optimal vascular and skeletal function. Additionally, foods rich in nitrates, including beets, spinach, arugula, and even small amounts of dark chocolate, contribute to the body's production of nitric oxide, a natural molecule that relaxes blood vessels and improves circulation. By including these foods consistently in meals, seniors create an ideal environment for K2 and D3 to function effectively, complementing supplementation and supporting cardiovascular, skeletal, and overall systemic health. Over time, a diet built around these nutrient-dense options not only helps maintain arterial flexibility, but also enhances energy, reduces feelings of fatigue in the extremities, and supports functional independence. Hydration and circulation. Hydration is a foundational element in maintaining healthy blood flow and overall cardiovascular efficiency. Blood is composed primarily of water, and even mild dehydration can increase its viscosity, forcing the heart to work harder to deliver oxygen and nutrients to tissues. Seniors are particularly susceptible to reduced hydration, whether due to a diminished sense of thirst, medication effects, or lifestyle factors, which can affect circulation and overall energy. A practical guideline is to aim for roughly half your body weight in ounces of water per day. For example, someone weighing 150 pounds should target approximately 75 ounces. Rather than consuming all fluids at once, it is more effective to sip water consistently throughout the day, keeping blood volume stable and supporting nutrient transport to muscles, brain tissue, and extremities. Maintaining adequate hydration also aids in regulating body temperature, supporting joint mobility, and improving digestion, all of which contribute to overall vitality. Simple strategies, such as keeping a water bottle nearby, adding slices of citrus or cucumber for flavor, or consuming water, rich foods like melons, cucumbers, and soups, make staying hydrated manageable and enjoyable. Over time, consistent hydration enhances the effectiveness of vitamins, dietary nitrates, and circulatory exercises, creating a synergistic approach to vascular health and everyday comfort. Movement and circulation. Regular movement is one of the most effective ways to support circulation, yet it does not require intense exercise or hours at the gym. Even gentle activity, such as walking for 10 to 15 minutes, multiple times per day, can stimulate blood flow, prevent pooling in the lower extremities, and promote cardiovascular efficiency. Muscle contractions during movement act as a secondary pump, pushing blood through the veins back toward the heart, which is especially important for seniors experiencing mild swelling or stiffness in the legs and feet. Incorporating short periods of movement throughout the day also enhances nitric oxide production, supporting arterial relaxation and overall vascular flexibility. Light stretching, yoga, or even standing while performing household tasks can further increase blood flow to areas that tend to stagnate during prolonged sitting. Importantly, these movement habits also stimulate metabolism, improve joint mobility, and support overall energy levels, making daily activities feel easier and more comfortable. By consistently integrating brief bouts of movement into a routine, seniors can maintain more even circulation, reduce fatigue, and support a heart-healthy lifestyle without requiring strenuous effort. Neuropathy and blood flow. Peripheral neuropathy, experienced as tingling, numbness, or mild discomfort in the hands and feet, is closely linked to circulation and the health of tiny blood vessels that deliver oxygen and nutrients to nerve endings. When capillaries are unable to maintain optimal flow, nerve cells may become stressed or less responsive, leading to these BEM sensations. While foundational nutrients like vitamin K2 and D3 improve overall circulation, targeted support can further enhance nerve health. Alpha-lipoic acid, ALA, is a versatile antioxidant that is both water and fat-soluble, enabling it to penetrate nerve cells and support repair and regeneration. Clinical studies suggest that daily doses of around 600 milligrams of ALA can reduce nerve-related discomfort, complementing the circulatory benefits provided by K2 and D3. This dual approach addresses both vascular and neural health, helping seniors feel lighter, more comfortable, and more functional in daily tasks. Additionally, combining ALA with nitrate-rich foods, hydration, and gentle movement ensures that nerves receive adequate blood flow, oxygen, and nutrients, supporting sustained functional improvements over time. Regular attention to nerve and vascular health together promotes mobility, reduces sensations of fatigue, and enhances overall well-being. Posture and blood flow. Posture significantly influences circulation, particularly for seniors who spend extended periods seated or leaning forward. Slouching or hunching compresses arteries and veins, reducing the efficiency of blood flow to the legs, feet, and even the brain. Integrating small posture adjustments, such as standing or walking for a brief period every hour, helps maintain continuous blood movement and prevents pooling in the lower extremities. Additionally, elevating the legs above heart level for 15 minutes several times a day promotes venous return, helping blood travel back toward the core and reducing swelling or discomfort in the ankles and feet. These simple practices use natural principles of gravity and movement to complement nutritional and supplemental strategies, creating a more consistent and comfortable circulatory system. Over time, combining upright movement, leg elevation, and mindful posture enhances energy, reduces fatigue, and supports healthy vessel function. Seniors who integrate these habits into daily routines often notice improved leg comfort, reduced feelings of heaviness or numbness, and a greater sense of ease during standing, walking, and other everyday activities. Breathing and circulation. The way we breathe also has a direct effect on blood flow. Deep diaphragmatic breathing or belly breathing helps create a gentle vacuum that draws venous blood from the lower body back toward the heart, supporting efficient circulation. Practicing slow, controlled breaths for 5 minutes daily strengthens this natural assistance system, enhancing oxygen delivery and nutrient distribution to muscles, brain, and extremities. When combined with posture adjustments, leg elevation, and regular movement, deep breathing amplifies overall circulatory efficiency and provides a calming effect that supports stress management. Over time, consistent practice of diaphragmatic breathing can improve vascular flexibility, support cardiovascular performance, and contribute to a sense of calm and vitality. Seniors can integrate breathing exercises into morning routines, during breaks, or even while relaxing in the evening to support a steady, reliable flow of blood throughout the body. Stress management and circulation. Chronic stress subtly influences blood flow, as stress hormones like cortisol and adrenaline can constrict blood vessels and impact the body's natural ability to relax arteries. Even brief periods of daily relaxation can have meaningful effects on circulation. Mindfulness practices, meditation, listening to calming music, or gentle stretching can help maintain vessel flexibility and allow supplements and nutrients to work more effectively. These simple stress management habits support nitric oxide production, heart function, and overall vascular efficiency. Incorporating stress reduction consistently helps maintain a calmer, more responsive cardiovascular system, complementing lifestyle, dietary, and supplemental strategies. Over time, managing stress contributes not only to improved circulation, but also to better sleep, energy balance, and overall resilience in everyday activities. Healthy fats and vascular function. Including the right types of fats in the diet is essential for supporting blood vessel health. Anti-inflammatory, stable fats like extra virgin olive oil, avocados, and omega-3 fatty acids from fatty fish help maintain the flexibility and integrity of arteries, supporting smooth blood flow. These fats also provide key nutrients for heart and brain health, reinforcing the effects of K2 and D3 on circulation. Conversely, excessive intake of processed vegetable oils rich in omega-6 fats may increase mild inflammation over time, which can reduce vascular flexibility. By emphasizing nutrient-dense, heart-friendly fats, seniors can support overall vascular structure, complement nutritional strategies, and promote cardiovascular comfort. Integrating these healthy fats into meals also helps with absorption of fat-soluble vitamins, enhancing their effectiveness in maintaining arterial health and overall energy. Sleep and blood flow. Sleep is a critical, often overlooked factor in maintaining healthy circulation. During deep, restorative sleep, the body repairs endothelial lining, balances hormones, and reduces inflammation, all essential processes for maintaining vascular flexibility and effective blood flow. Seniors should aim for 7 to 8 hours of quality sleep each night to allow these restorative processes to function optimally. Creating a consistent bedtime routine, limiting evening screen time, and ensuring a comfortable sleeping environment all contribute to improved vascular health. Over time, adequate sleep enhances the benefits of dietary choices, movement, posture, breathing practices, and supplementation, ensuring that circulation remains consistent and reliable. By prioritizing sleep, seniors also support energy, cognitive function, and overall quality of life. L-arginine and nitric oxide support. L-arginine, a naturally occurring amino acid, is a precursor to nitric oxide, the body's primary molecule for relaxing and widening blood vessels. By supporting nitric oxide production, L-arginine helps improve circulation, allowing blood to flow more efficiently to tissues and organs. Daily supplementation of 3 to 5 grams can be particularly beneficial for seniors looking to complement foundational circulation support. Working in synergy with vitamins K2 and D3, incorporating L-arginine into a broader wellness routine supports both immediate improvements in vessel relaxation and long-term vascular flexibility. Foods like nuts, seeds, legumes, and certain whole grains also contain L-arginine, making dietary inclusion an easy way to reinforce supplemental strategies. Consistent intake, combined with hydration and movement, enhances the overall efficiency of the circulatory system and helps maintain comfort and vitality throughout the day. Coenzyme Q10 and heart support. And coenzyme Q10, CoQ10, is essential for energy production within cells, particularly in the heart, which requires increased energy as circulation improves. CoQ10 also acts as a powerful antioxidant, protecting blood vessel walls from oxidative stress and supporting overall vascular health. Seniors, especially those taking cholesterol-lowering medications, such as statins, may benefit from a daily dose of 100 to 200 milligrams, as these medications can reduce natural CoQ10 levels. Supplementing with CoQ10 ensures that the heart can efficiently support enhanced circulation, allowing the vascular system to respond more effectively to movement, nutrition, and other lifestyle interventions. Over time, maintaining adequate CoQ10 levels can contribute to sustained cardiovascular performance, energy, and overall resilience, supporting the body's capacity to circulate blood efficiently and consistently. Creating a daily circulation routine. A structured daily routine can integrate supplements, movement, and lifestyle habits to maximize blood flow and overall vascular health. Begin with foundational vitamins K2, MK 180, 360 micrograms, and D3, 2,000, $5,000 IU, taken with a small source of healthy fat such as olive oil to support absorption. Include nitrate-rich foods like spinach, arugula, or beet powder, which naturally promote nitric oxide production. For seniors addressing neuropathy, alpha-lipoic acid and L-arginine may be incorporated alongside these nutrients. Maintain consistent hydration throughout the day, take short hourly movement breaks, and elevate the legs for 15 minutes in the afternoon while practicing deep diaphragmatic breathing. In the evening, take CoQ10 and aim for 7 to 8 hours of restorative sleep. Following this structured routine encourages arterial flexibility, supports endothelial repair, enhances nutrient delivery to tissues, and promotes both comfort and overall vitality. Reclaiming circulation and vitality. Improving circulation is about more than addressing discomfort. It enhances functional independence, energy, and quality of life. Even after age 60, the body maintains a remarkable capacity to adapt and regenerate when provided with the right nutrients, movement, and supportive habits. Addressing vascular flexibility, nitric oxide production, and nerve support allows seniors to experience reduced tingling or numbness, increased energy, and greater ease in daily activities. Consistent attention to circulation supports heart function, brain health, and extremity comfort, helping seniors remain active, engaged, and independent. By integrating nutritional, supplemental, and lifestyle strategies, seniors can create a sustainable approach to maintaining a vibrant, healthy circulatory system that supports overall wellness for years to come. Final thoughts. Age is not a limitation, and the presence of occasional tingling, coldness, or mild numbness does not mean decline is inevitable. These signs can simply indicate that circulation would benefit from attention and support. Prioritizing foundational vitamins such as K2 and D3, including nutrient-rich foods, maintaining hydration, incorporating movement and posture adjustments, practicing deep breathing, managing stress, and ensuring quality sleep create a holistic approach to supporting vascular health. Additional compounds like alpha-lipoic acid, L-arginine, and CoQ10 further enhance circulation, nerve health, and cardiovascular function. By addressing these areas together, seniors can promote arterial flexibility, efficient blood flow, and overall well-being. This comprehensive, supportive strategy allows older adults to reclaim comfort, energy, and independence, demonstrating that with consistent attention and care, circulatory health can be improved at any age.